I don't know if you're a John Steinbeck fan, but what I have for you today is a tale of mice and men, and women, of course. Scientists have just shown that a certain type of drug can not only halt the progression of Alzheimer's in the brains of mice, but actually reverse it. So that's a pretty big deal. But that's with mice. The question now is, can these medications work on humans? And that's where you come into the story. Hi, I'm Tony Daring of GoCogno.com, the website for people with mild cognitive impairment. If you've been diagnosed with MCI, you're hearing a steady drumbeat of negativity. Nothing works. All the drugs fail. If they ever find a cure, it's going to be 20 years from now. Please, please don't listen to that. As one of the leading Alzheimer's research organizations tells us, we are closing in on a cure. There are some very promising new medications in the pipeline, and one of them is a class of drugs called BACE1 inhibitors. I recently wrote a long article about these medications, but here's the short version. One of the hallmarks of Alzheimer's disease is the beta amyloid plaques that begin to form and gunk up the brain. BACE1 is an enzyme that feeds those plaques. So the theory is, if you can find a medication that inhibits the BACE1, it may cause the plaques to slow down or maybe even clear away. Just a couple weeks ago, the Cleveland Clinic reported the results of a study in which they gradually reduced the BACE1 enzyme in the brains of mice with Alzheimer's. They expected it to slow the growth of plaque in the brain, and it did. But here's what they didn't expect. It actually eliminated the plaque. That's promising and exciting. Now, the task is to show that it can do the same for humans. And right now, there are several clinical trials going on seeking to demonstrate that. If you've been diagnosed with MCI, you are a potential candidate to receive one of these experimental drugs. One of the studies is called Mission AD. Here are 3 good reasons that you might want to consider that trial. The drug is being developed by Eisai Company, the same firm that helped bring us Aricept. The drug being tested has a good record for safety. And third, this study is broadly available. There are more than 100 test sites across 20 states in the US, and it's being done in 16 other countries as well. If you're interested in learning more, go to the website of the study, which is missionad.com. I've also put together a list of the test sites so you can see if there might be one near you. If you would like that list, email me and I'll be glad to send it to you. Now, even if you can't take part in that study or you don't want to, I wanted to share this information with you anyway, just to show you that there is reason for hope. There are some promising drugs out there, and researchers feel we're getting close. I recently talked to Dr. Michelle Papka, who's one of the researchers in the Mission AD trial and several other trials. And she told me, I think we're on the brink of something. Every time there's something in the media about a failed trial, it gives everyone the idea that none of these drugs are going to work. Just because one study failed doesn't mean they're all going to fail. We have got to get the right drug to the right person at the right time. One of these drugs is going to turn out to be the right drug. It's just a question of which one. Will it be this one? I hope so, and I hope to see you again next week. Until then, as always, be kind to your mind.